vacation to the mainland, then the requirement does not apply.
And let's get Dr. Felix Cabrera, the Chief Medical Officer for the Department of Public Health and Social Services, to kind of go in on this new guidance. Doc, good morning.
Good morning. Good morning, Chris. Good morning, Bree.
Good morning.
So your 2 cents on that?
I think that this is a good move overall. It only strengthens our ability overall to protect our island, in particular when we're considering Guam's status. And so it will only affect currently, a small percentage of travelers coming to Guam, given that most of the travelers entering Guam are domestic travelers. And so that's where we are. We are looking into it. And in all honesty, probably the next phase of any change in the quarantine will probably incorporate a PCR test or a antigen test prior to arrival, if there's going to be any adjustments to that, to our current quarantine protocol. So it doesn't change anything too much. It actually, we think it's fine, and we welcome it.
Yeah, it was something that John Kanata over at the airport, he had been hinting that something was coming down about testing at the airport before you leave Guam. So now, when we get this guidance, so if I decide to go on vacation, I don't need to take a PCR test 3 days before I leave.
Go on vacation where? Oh, before
to the
you
States.
You're talking
Yeah,
about
to the States.
Yeah.
Yeah.
To the States currently. That doesn't
Okay.
appear what the requirement is.
Yeah.
That you're still traveling domestically.
Yeah, just want to make sure, because sometimes people treat Guam as if it's international.
Yeah.
Sure. Yeah, but I think they made that clear in this regard, and it's still being looked into. But from my understanding, that even if you're transiting, let's say you're transiting to Tokyo, that requirement won't necessarily be in place, because your point of disembarkment was, if it was domestic, then that should still be okay upon entering Guam.
Doc, let me ask you this. Now, obviously, this new guidance is meant to put more teeth, right, in protocols that and mitigation efforts for the spread of the virus. And if it doesn't apply to us, do we need to step up in any way to kind of fill in whatever gaps this new guidance was trying to fill in?
We're already much stronger than that. Now, remember, we have mandatory quarantine basically, and that we have in the government facility, and so that's not something that's happening in the rest of the continental U.S., for example. And so it's really just you enter and then nothing else. But then now they're just adding this one layer, and then everything else is about a suggestion of a test 3 to 5 days later. Here we actually test on the 6th day, and so it's actually, we're already much stronger than this requirement. We are ahead of the game. The governor's made it very clear that she has no intention of changing right now. It's very important that we continue our quarantine requirements as it is right now for travelers entering, in especially with the threat of the variant strain in the world. That's something that we do not want here on this island.
Yeah, I think that's also part of the reason why the CDC put forth this memo, was because of that variant.
Yeah.
So tonight at the PAG, what will you guys be discussing?
So there's probably this will be a good topic, but it's likely going to include also vaccinations and testing. All the efforts that that's going through right now. And so, a lot of the focus is on vaccination and scaling up. There was a very, very important meeting that happened yesterday morning where the state surgeon cell presented to General Perna, who's the head of Operation Warp Speed, presented a build-up plan for our vaccination. And basically, we're the main argument is that we don't want the excuse that manufacturing or anything is going to limit Guam supply. That we are actually one of the top in the nation in terms of actually vaccinating the percentage of our population. And because of that, because we're using it so efficiently, we want a higher allocation. And so we're talking, right now we're allowed to order about 15,000 doses a month. We want that number to go up to at least 35,000, in all honesty, for us to be able to to meet certain benchmarks and goals for what we want to accomplish in terms of herd immunity. Now, the chief medical scientist officer or something like that at the WHO does not think that the world will achieve herd immunity this year, and so but admits that there will be pockets of areas around in several countries, in several areas that will achieve this, and we want to be one of those, and we believe we can actually even by potentially this summer.
So what was the response from General Perna?
One is he promised us that we will get our minimum of the 15,000, and that now and then he'll do everything he can to increase that allotment. And this coincides exactly with the HHS Secretary Azar, who's now stating that they are going to be releasing more of these sort of reserves, second dose reserves, to areas, especially those areas that are particularly very efficient in administering vaccines. If you look at the Bloomberg website, they actually have a more up-to-date, even more up-to-date than the New York Times numbers of how the states and territories are performing. And and when you look at that as shots per capita, guess who's number one and number two? Basically the Mariana Islands, both Guam and the CNMI. And so CNMI edging out just a little bit, but that's really impressive, and that's something that we should be extremely proud of. I know that there's a lot of things that we can do better on, and we will do better on, but this is really a tremendous accomplishment that we're doing here on this island, and we're only going to grow exponentially from here. I will say that there's very heavy plans and things in motion for getting the UOG field house online to be a vaccination site. And this is in addition to what we're already doing, for example. And then we're also working on getting it rolled out to more of the private clinics so that patients that are already scheduled can get it during their visit if they meet the criteria. So there's a lot going on, and we are, this is one of the biggest operational efforts here on this island since, probably World War II. And there's a lot of moving parts, but every day we're learning and from our mistakes, and we're getting more efficient.
So you think if we get the extra vaccines that we're asking for, will we be able to handle that additional workload?
Yeah. Yes. And so right now, this is all very rough. This is all mostly theoretic, but it's actually not even that theoretic, because we actually see ourselves very, doing this actually very realistically, is giving out as much as 8,700 vaccines every week. And that's something that we're really close to doing, in all honesty. And so now there's going to be staples in this, where, like, for example, in Arahan, at the Southern Regional Community Health Center, that's going to be a staple in terms of a vaccine site. We have Okudu, obviously, but if Okudu is no longer available, there's contingencies for that as well that are being worked on. And then in addition, having UOG Field House as a staple as well. And then, of course, the clinics themselves being a staple.
Mm-hmm. When is public health going to move from Category 1C to a different category? I don't recall what the next level is.
So right now, again, because we're in 1C for certain groups, right? And so we don't have all of 1B. We do have all of 1A that are greenlit, basically. And so the next step that we're, right now, I'll just give you some. This is not counting this week. This is since at the end of last week. For the 75 plus, we've vaccinated at least the first vaccine about 28.7% of the 75 years and older. That's a preliminary result as of last week. That doesn't include this week's number. And for the 60 to 74-year-old, we vaccinated about 11.4% of them as of January 9. And so we're doing so much, but there's still so much within that group that we still have to vaccinate. But then we have to still balance that with the needs of ensuring that we take care of some other persons in the 1B, particular school-based staff is another big one that we are targeting, and we'll see if the VA PPC, the vaccine committee, what will be the next step in terms of expanding that, and if that group is going to be entered in, or maybe one or another potential is that persons below 60 years old with multiple comorbidities, could be under consideration as well.
Okay. Do you have do you guys break it down, like which agencies in the government have been vaccinated?
I don't.
Like we have
them
some
all,
members in the
we
judicial
have,
branch. We have has the port been vaccinated, or
Teachers,
airport,
bus drivers.
teleworkers? Teleworkers being
I
vaccinated?
don't have those. I don't think so. I can't comment. I don't know the specifics of them right now. Sorry.
Would teleworkers though be on a priority?
No, we frontline. That's why even like, for example, GDOE, we're saying school-based staff, those who will be there. So not, those who are not necessarily located at the schools.
So that's still the plan though for GDOE employees next week.
Well, under consideration, and not just them, but also private school as well. So all of education.
What clinics are offering the vaccination currently?
Right now, AMC is online. HSP technically they are capable as well, and they're doing mostly the homebound and also for example St. Dominic's and other clients of theirs, basically patient clients, and so those are the two right now. I know that AMC is also really Dr. Wen in particular has been really being helpful to get the other clinics online as well, helping with training. For example, SDA, FHP. So this is a very, major partnership amongst both the private and public entities, and it's because we all just have one goal. We just want to vaccinate as many people as we can, as quickly as we can.
I wanted to ask about what happened with the fire department. Maybe you could provide some clarity on it, because we know there's two other, I think it was the last story, two other firefighters that tested positive for COVID. But the first one, we were able to confirm that he tested positive even after getting the second dose of the vaccine. So I don't know, and it was kind of the same day. Like the same day he went in, got the vaccine, then later on he tested positive for COVID. Same day.
Yeah, and so I don't have any specific details about that at all, but just understanding that's totally within the realm of possibilities, right? And so we know that really you're most protected at least a week or two after your second dose. So you're still susceptible, and we know that even after that there's at least a 5% chance that you're still susceptible. So obviously the even after the first dose you're about 50%, and then it builds up from there. And so the odds are that people are going to get sick and still have COVID, even in these different steps of the vaccination process. So
is that something though that you guys would track or even notate?
I think it will notate for sure, but it's not something. Yeah, but it's something that we hope. It's very likely a very easy thing, because once the contact tracing starts and the person's put in isolation, that's probably going to be easily one of the things that are revealed right away. It's like, oh, I just finished my vaccine. Just 3 weeks ago or something like that, for example, and then those things will be that information will be easily available, and we can pull that as we see if we're seeing certain trends.
Okay.
All right. Anything else, Doc?
No, I just want to say that at the same time, we keep talking about vaccines, but testing is still extremely important, and the rapid engagement team is going to be going out again on Saturday. And going to be doing testing, and so there'll be more information. I think Janela Cabrera will be on, and she can speak about that later this morning. And so, there's that part there, but there's also serial testing, like for example, the school-based staff that we want to encourage serial testing for them, so that that's available. So those things are still a big part of the whole operations, and we always have to keep our eyes on that as well. But so far, our testing numbers are good. We're doing enough tests to identify. I feel that the positives that we are seeing, the new cases, are a decent reflection of actual community prevalence right now. So but we're still curious about certain pockets. So that's why rapid engagement team is being deployed, and so that we can make sure that that truly is a representation and hopefully stem some potential spread.
Okay, I guess we'll get Janelle on the rapid engagement team's deployment.
Right on. That's later on in the show. Doc, appreciate your time this morning.
Sure.
Okay, that's Chief Medical Officer.
Thanks, everyone.
Okay,
Have a good morning.
DPHSS, Dr. Felix Cabrera. 7-11, we'll just keep it in the KUAM News Zoom room as we had a crazy start to the show and just right out the gate.